So thank you again for joining us, Patty. Can you start by telling us a little bit about your cancer journey?
Sure. I was diagnosed 4 years ago with stage 3 lobular breast cancer, which I found myself. It was missed on mammography done 5 months before, and it was very large. It was 5 by 6 by 3. So every person that I saw at UCLA after the diagnosis, everybody went back and looked at the mammography scans, and it wasn't there. It wasn't visible because if you remember, lobular is like lattice work, so it hides between the tissue and it's really hard to detect. Um, I hopefully someday, maybe ultrasounds, and I've actually had conversations with mammogram techs because they tell me that ultrasound is the ultimate way to diagnose all breast cancers. Hopefully someday we can move towards that. And then I went through radiation. I did a clinical trial with a CDK4/6 inhibitor. It was a concept trial to look at how fast the cells were overturning. Then I went through the mastectomy. Then I went a single mastectomy. Then I went through radiation. And then my implant failed because of the radiation. So I had no choice but to have the flap surgery. So I had to have the flap surgery. And unfortunately, in the flap surgery, they realized that there was a lymph node that was positive. So that surprised everybody because it was in the field of radiation. It was after taking the CDK4/6 inhibitor. So no one quite knew what to do with me. I was considered locally advanced, not metastatic. I had a PET scan, didn't show any metastatic disease. So then I started on Ibrance at that point, and also Foslodex. They took me off the aromatase inhibitor. So then Dr. Hurvitz said, we don't really have any data for this kind of treatment for people with locally advanced. It's all in the metastatic setting. So I want to keep you on it 2 years. This year when I went to see her, it was my 2-year mark in February. And she said, could we do it another year? Which was disappointing, but it's my insurance policy. So I've told hundreds of cancer patients that this is your insurance policy. So I must practice what I preach. And the biggest problem for me was the fatigue and commuting, an hour each way or an hour and a half each way. But now during the pandemic, my commuting has been from the bedroom to the living room. So actually I do feel the fatigue is different. It's not as overwhelming as it was when I had to do all the commuting.
Yeah. So you talked about doing the commuting. So you are an oncology nurse. So
I am.
yeah. So what kind of impact did your experience in that role have when you found yourself on the other side of the hospital bed, so to speak?
Well, um, it was terrifying. And I tell the story. I had a young patient in her 30s that was diagnosed with non-Hodgkin's lymphoma, and she had a 2-year-old and a 5-year-old, and she used the word terror. And I had just been diagnosed a few months before that. Of course, I never told my patients, but when I was sitting with her, her family was far away. Her husband had to take care of the kids. Her parents had to take care of the kids. So she was basically alone getting this really high, intense chemotherapy, and obviously sad, depressed, and she would get bad mouth sores. So I would go over to the 7-Eleven and get her Slurpees because that was the only thing that felt good for her. And the word terror actually is something that she taught me, and I realized it's so true. We're all anxious and we're all scared right now, but that's very different than actual terror, actually having something face you. And I'm sure there's people positive with COVID-19 right now that are experiencing terror because you don't know which way it's going to go, and it can be terrifying. So I've always thought I was empathic for my patients. I definitely became more empathic. And one of the things I did journaling when I was first diagnosed, and I started to realize there's a lot of unsupported social interactions out there. And there's actually great nursing research on that. There's been a couple of really good studies. People don't know what to say, so they say bad things or inappropriate things. And I know people mean well, but I'm now protective of my cancer patients. Just don't say anything. Just offer to do something. Offer to, pick up my kids at school. Offer to do that. But trying to make me feel better is not going to do that by saying something that you don't really understand what's going on with that person. I'll give you a couple of examples. One that really sticks out. I had to go back and have another ultrasound and a biopsy because I was on this clinical trial. So I walked into the ultrasound room, and I had an MRI like 2 days before. This young girl who was so kind to me when I was first diagnosed, I said, wow, did you see my MRI? I said, it looks like, the treatment's working. My disease is responding. She goes, yeah. She goes, that's great. I really thought you were someone that wouldn't do well. I'm like, what? This is a healthcare provider saying that to me? I didn't think that. And I remember walking out, my daughter was waiting in the waiting room. My daughter was probably 19 at the time. And I told my daughter, I said, Mackenzie, this woman just said this to me. And my daughter was furious. I mean, I was in too much shock to be furious about it, but it taught me that silence is okay. Being quiet, being mindful. And I started meditating, doing mindful awareness. I have to say, I do a lot of Tibetan bowls because I really find them relaxing, but really being quiet as a nurse and being present. And I know that we're trying really hard to take care of healthcare providers right now, both physically and psychologically. So there's probably going to be a lot coming out from that. But I do teach my new grads, just listen, just sit there. Don't stand over them. That's my other pet peeve. Don't stand over me, sit down next to me. And I have to say my oncologist and her nurse practitioner are great at pulling up chairs and being on the same level with me.
That's great. So you touched on this just briefly about how it's just impacting everyone in general, but how is COVID-19 impacting you right now? What is really like a day in the life of Patty Jakel?
I'm so sad that I had to leave work. And I was given the choice of stopping the treatment or working from home by my oncologist because my white count was low. It was only 2. And it's not the people we know that have it. I can stay out of those isolation rooms. I can stay out of those isolation rooms, but I can't, I don't know who's in the hallway, who's in the elevator with me, who's going to infect me in the cafeteria. So that's what we're all fearful of. And now we're allowing masking within the hospital. We were trying to really hold off on that, but people are walking around with their masks. They were doing it anyway. So UCLA decided that, yes, we would let people do masking in the hallways. There's a lot to be said about that. But anyway, and I told my family, I told my husband and my children what the choice was. And then I told my sisters, and my sisters all had to weigh in, and everybody had to have an opinion. And I kept saying, this is my choice. This is a choice I have to make. As a nurse, an oncology nurse for 37 years, I really wanted to be there. I really wanted to take care of the staff and the patients. And my 2 units that I supervise in the acute care setting at UCLA are both oncology floors. And right now we're not taking any COVID patients there because we want to keep our neutropenic patients, our leukemic patients, all of those staff safe. So I made the decision that I would stay on the medication and I could be really effective from home. Hopefully I am being effective. I get great feedback. I'm actually in charge of the safety champions that are doing, going around making sure people are putting on their PPEs correctly, taking off. So I'm really coaching staff from afar. We're all learning new skills. So this is a skill, but I do miss the patients. And the highlight of my day yesterday was going to the oncology clinic to get my Faslodex injections. And anybody listening to this that's ever had the injections knows it's not very pleasant. It's not something you look forward to, but I actually did yesterday. I looked forward to it. But it was really a reality of getting off the elevator, and there's a desk set up with a nurse screening everybody. There's 4 different UCLA clinics there. And then when I got to the clinic I was going to, there was another screening process. Plus they had called me the day before. So healthcare systems are working really hard to take care of their patients with chronic disease, and especially the cancer patients that need their treatment. We're still admitting chemo patients to the hospital, probably 3 to 4 per day, so that we can keep people on track for their treatment and keep them safe.
That's great. So then as a patient, what precautions are you taking right now to kind of safeguard yourself against the pandemic as you continue to work in the hospital? So to speak.
I had been wearing masks for a while, and I was one of those people that years ago used to make fun of people were walking around with masks in the airport. And now I'm like, well, maybe they knew something I didn't know. So I take back my humor for that. So I wear a mask wherever I go. No one can come into our house. There are 2 people that are allowed, my daughter's boyfriend, and his dad's a physician. So he's very keen on being safe. And then my husband's best friend, because he provides comic relief. So I make sure he doesn't have a fever, and I make sure he scrubs his hands in the bathroom. And I took away all my fancy towels. Everybody uses paper towels now. And I'm not going to the markets. I told my daughter she's the canary in the coal mine, because I put a mask on her, and my kids have known about hand washing since they were little. They're really good about that. And, wipes, we can't get any Clorox wipes anymore, but we made our own. So she's really good about staying safe and going out and doing the grocery shopping. And I would recommend for people, one of the things I started a couple of weeks ago is I unload all my groceries in the garage, and then I spray them and wipe them all down, let them dry, except for the ice cream. I had to go in the freezer because it's a little warm out here. So I just make sure I'm wiping every single thing down, and I'm not bringing the grocery bags into the house anymore.
That's a good idea. So
Yeah.
then, can you then address any challenges that you've experienced as a nurse throughout any of this? Maybe staffing, PPE shortages, things like that?
Well, the surge is coming to LA. They keep telling us. I heard this morning I do a safety call. We have a safety call. We have a command center. It started about a month ago. So every morning I'm on the line on Zoom listening to the safety call. The way they're plotting it out, in about 2 weeks, we will be at the epidemic level in Southern California. And of course, 2 weeks ago, when they told us all to stay at home, we all saw the photos of our beaches, our hiking trails. I actually was working that weekend and driving home on Pacific Coast Highway. It was a lovely day. It was 75 and the beaches were packed. I'm like, wait, weren't we told to stay at home? So that has been a real challenge, but we're okay with PPE right now. We're doing kind of innovative things. University of Nebraska is doing UV lighting on the N95 mask. So we've been trialing that at our big hospital. We're going to be trialing it in the little hospital soon. So right now it's okay, but people have a lot of anxiety. They have a lot of anger because of their anxiety. It's misplaced. So it has been a challenge, but I have to say we've all been working really, really hard. But the thing that shocks me as a healthcare worker, and I'm going to tell you, it's on me too. Where was I in January and December? Why weren't things being done back then? I know we can't look back, but I think we need to fix a broken system. And I'm as complacent as anyone. Oh, it's happening in China. There's people watching this. The CDC, the WHO, there's going to be all kinds of guidelines. And guess what? Here we are. Our economy is at a screeching halt. If I wasn't so busy taking care of staff right now, if I let myself think about 6 months down the road, I would probably be terrified. So I'm trying just to look, I worked with someone once that said, just look at the step in front of you when you're climbing a big hill. Don't try to see the top of the hill. And I thought, I've climbed a lot of hills walking or running where I've only looked at what's right in front of me. So I'm trying to focus on what's right in front of me, making sure the staff is educated, making sure they're safe, and making sure there's appropriate PPE. And it's great that it's happening 15 years later than, 15 years ago, because technology has improved so much that we can actually do these kinds of things.
That's true. So now you have a unique perspective as a nurse and a patient. But do you have any advice for patients who may be worried about their health through the pandemic right now?
Well, stress increases your stress hormones. So try not to worry. And I know that's easier said than done. Absolutely. I'm worried. I'm worried for healthcare right now, but try to find things to decrease your stress. The weather's getting nicer. If you can just walk around your block, social distancing or physical distancing is what we're calling it now, or if you want to wear a mask, that's totally appropriate. Wash your hands. And when you think you're doing a good job, do it again. And there's two things that have come out of this that are going to be good. Everybody's going to learn how to wash their hands. And LA's had no traffic, but all of us are going to get speeding tickets because you can drive fast on freeways. But if I was a patient, I would tell you, and people that come into your house, they need to wash their hands, and you need to screen them. You have a right as of a patient to say, are you coughing? Do you have a runny nose? Have you had a fever? And you really don't need people to come over. Maybe people have to bring you groceries, but you really should socially isolate. And it's hard. I mean, it's really difficult. And I'm fortunate that I live a place where it's nice weather, and I can get out and walk for a mile or two and not have to encounter people. But people still don't get the physical distancing. So I'm reminding people of that. I actually told people that yesterday on the sidewalk, that I walked off the sidewalk and they're still coming towards me. So I think we have to empower ourselves to be our own stewards of what's going on around us.
Yeah. Now, do you have any other tips in terms of how to deal with things? Obviously, there's the physical, there's the hand washing, there's all that stuff.
Mhm.
But what about the mental side of things?
Everybody has to find their own place. There's so many free meditations out there. UCLA has a mindful awareness app. It's UCLA Mindfulness. It's free. Download it. I like it because the meditations are only between 7 and 12 minutes long. I'm not a good, and Deepak Chopra actually and Oprah have their 25 sessions for free right now too. So just get out there, find what works for you. If walking meditation works, or just being outside, I don't care if you go through Netflix for 5 hours. I do think though it's a little tough on your body not to get up and get moving. And if you have pets bring joy. We have 2 shelter rescues that we got in January that we're training. They're a little bit of a challenge, but that's what happens when you live your life in a shelter. So it's good. So things that you were doing to take care of yourself during your cancer treatments, you should ramp it up a little bit, because the social isolation is really difficult, and the fear and anxiety. I personally think you should turn off the news, maybe listen to a little news in the morning, an update, because you want to be updated, but it's nonstop. It's nonstop. And the projections and this expert and that expert can really put you in a bad place. So listen to music, do things that make you happy.
That's great. Well, thank you so much for joining us today, Patty.
My pleasure. Have a good day.
You too.